All right, Chris, you had a fabulous article in The Federalist today talking about this, why Pete Buttigieg's healthcare plan might be crazier than Bernie's. I encourage all of our viewers at the commercial break to go take a look at it. But talk to me about your analysis. This price control aspect of Pete Buttigieg's healthcare plan. What is it, and what impact will it have on private insurance?
Sure. Buttigieg says that for all forms of health care, that he is going to cap prices that doctors can charge patients no more than twice of what Medicare pays. And so what that means is, effectively, no matter how good the doctor is, how desperate you are to see a doctor, you can't pay a doctor more than twice what Medicare pays. In other words, if Medicare will pay $50, and you think the doctor's service is worth $200, you can't pay that. You can only pay $100 for the doctor. Now, that might sound good in theory. Oh, it'll bring down the cost of health care. But the other thing is it will result in shortages and rationing because doctors might leave the profession. They might not join the profession, decide to become something other than a physician if they're going to have pay cuts under Pete Buttigieg's plan.
Right, so that's the shortage issue. And by the way, we're already dealing with provider shortage in our country. I think it's like 12,000, I believe, is the number of physicians that we need in this country that we don't currently have. But part of this price capping, besides shortages, it could lead to single payer, which Pete Buttigieg admitted last week that's what his plan, that's what he hoped would happen with his plan. But explain to me exactly how reducing the payments to healthcare providers that are not through Medicare, how that would lead to only a single payer system.
Sure. Well, Pete Buttigieg, for one thing, wants his plan to become a glide path to a single payer system. And the price caps are a very easy way to do that. In other words, you just ratchet down the price caps and say first doctors can charge no more than 2 times Medicare rates, then 1.5 times Medicare rates. Then eventually, if you end up with the price cap below Medicare rates, well, nobody will take private insurance because Medicare will pay them more. That's how you end up. It's a very easy way to kind of squeeze private insurance out of the system slowly and slowly over time, bit by bit, piece by piece, to sabotage the private coverage and get everybody on government health care.